thought disturbances, psychotic disorders, schizophrenia, schizophreniform, and delusional disorders. The disorders included in this section have defining features of psychotic symptoms. Psychotic symptoms are produced by a loss of ego boundaries and or a gross impairment in reality testing, which includes prominent hallucinations and delusions, disorganized speech, and grossly disorganized or catatonic behavior. Schizophrenia can be classified as positive or negative type, although most patients have a mixture of these symptoms. The positive symptoms include hallucinations, delusions, loose associations, and bizarre or disorganized behavior. The negative symptoms include restricted emotion, flat affect, anhedonia, avolition, alogia, and social withdrawal. Anhedonia is inability to feel pleasure. Depression symptom, not interested in relationship or any hobby. Avolition is inability to make decision, and alogia is inability to speak. Pathophysiology and etiology. The exact causation of these disorders remains unclear. The current consensus is that they result from complex interactions among a variety of factors. One is genetic factors. Research is focused on genes on chromosomes 6, 13, 18, and 22 as related to the development of schizophrenia. And biochemical structural brain factors, dopamine hypothesis. Hyperactivity of the dopaminergic system, possibly due to receptor neurons that are functionally hyperactive. Norepinephrine, serotonin, glutamate, and GABA, GABA may also have their role in modulating the symptoms of schizophrenia. Clinical manifestations, patient will have hallucinations, delusions, disorganized speech or behavior, peculiar behaviors, impairment in personal hygiene, marked lack of initiative, interest or energy, blunted or inappropriate affect. In catatonic type, waxy flexibility, agitation, extreme negativism or mutism, peculiar voluntary movement, posturing, stereotyped movements, prominent mannerisms, and prominent grimaces. Echolalia or echopraxia, and affective flattening, alogia, inability to speak, avolition, inability to make decisions. And diagnostic evaluations, clinical diagnosis by history collection and through the mental status examination, and routine laboratory tests like CBC, urine analysis, liver function test, thyroid function test, renal function test, HIV test, serum ceruloplasmin. That rules out Wilson disease and PET, positron emission tomography, and CT scan, MRI. Rating scale assessment, a scale for the assessment of negative symptoms, scale for assessment of positive symptoms. And the treatment, these disorders generally requiring long-term treatment. Typical or atypical neuroleptics, antipsychotics is the mainstay of treatment. The common atypical neuroleptics include clozapine, olanzapine, or risperidone. Psychosocial treatments, supportive therapy, family therapy, support groups in the community, psychiatric home care nursing, and vocational social skill education. Complications if left untreated, undiagnosed and untreated, or ineffectively treated, schizophrenia can lead to profound inability to function and contribute to the problem of homelessness in our society. Neglect of other medical conditions, therefore complications due to untreated medical illness are common. Depression and suicide, chemical use, abuse or dependency. Thank you.